okay, hanky are not properly clean, they can cause also this vestibulitis. So that's about your vestibulitis. So these are very short question, 2 marks question and all, but clinically they are important. Now major question important is DNS, deviated nasal septum. So septum is a midline partition of your nasal cavity. This septum, if you feel lower part, it is soft and movable. It is made up by the cartilage. The upper part, if you feel under the skin, it is tough, hard, it is bony. So septum is formed partially by the bone and partially by the cartilage. Now bones, mainly 2 bones are there, vomer and perpendicular plate of ethmoid. Even though contribution is there, minor contribution by sphenoid is there, frontal is there, but 2 important bones are there. One is perpendicular plate of ethmoid and another is the vomer. Then lower down we have septal cartilage. Now this septum straight midline, absolutely midline septum is very rare. Slight deviation is present in almost every person, but if deviation is more abnormal, then it is DNS. Now this DNS cause frequent rhinitis, it cause obstruction in the airflow, it cause difficulty in sleeping, even it cause dyspnea, it cause snoring, it can cause mouth breathing. It depends on the size of your DNS. Now this DNS, minor DNS do not need any surgery, okay. Sometimes due to DNS, if you examine the septum, along with that turbinates are also swollen, hypertrophy. I'll keep your mobile on mute mode. Yes, sir. Now DNS is very common. It requires treatment if there is any symptom of this. Now etiology. When you study any disease, you have to know the definition. After definition, etiology, causes are there. First is that congenital, by birth there can be DNS. Then trauma, injury can be there. Birth, molding due to developmental defect, high arch palate, the soft palate. If the soft palate is high arch, there will be deviation in the septum. Then unequal growth. It should be the symmetrical growth on both the sides should be symmetrical. Skull base and palate. There are 2 palatal processes. If the growth is not equal, it can cause the DNS. Then mass in opposite nasal cavity. In opposite side, if there is abnormal growth, abnormal tumor, then hypertrophy terminate, it can cause the DNS. Then racial factor is there, especially in the European. Okay, the DNS is more common in them. Then heredity is there. The parents, if they are having, then chances are more. Now type. What are the various type of? The type can be anterior DNS can be there, C shape, it can be like this curve, then it can be like this curve, S shape, it can be S shape. Then there is spur. Spur is a bony growth, shelf-like. The bone growth like a shelf, that is the septal spur. Then there will be thickening of septum. Thickening of septum can be there, and organized hematoma. In thickening, there will be blood accumulated due to trauma. That hematoma can cause it. Then impacted septum. Okay, that can be there. Now you see anterior septal. This is deviation here. This is anterior dislocation. Now C shape like this. C can be like this or it can be like this. C shape deviation is there. Then S shape, as I told you, deviation is like this, S shape deviation. Then nasal septal spur. Spur is a bony growth you see here. From this growth, here you can make out this one in the picture. This is septal spur. Now C shape DNS, not touching lateral wall of the nose. If you see, this is the septum. The septum is deformed here. But this lateral wall, it is not touching. It is not touching to the lateral wall. It may touch or it is not touching to this. See here, this is the cavity of the nose. This is the lateral wall of the nose. This is the nasal septum. This is the overgrowth. This is DNS, deviated septum, not touching the lateral wall. Now, touching the lateral wall. Here you see it touches. So, if it touches the lateral wall or if it do not touch the lateral wall. Now, compensatory turbinate hypertrophy, you see here. If septum is deviated, then turbinate, especially the inferior turbinate, they get hypertrophy. You can see thickened redness of the turbinates, concave. Now, what are the clinical features? The patient is coming with DNS. What the clinical feature is there? First is nasal block. Blockage of the nose will be there. Then paradoxical nasal obstruction. This side nasal septum deviation is there. This is blocked, but other side is blocked paradoxical. Opposite side because of hypertrophy. Hypertrophy on the opposite side of the concha or turbinate is there. That will cause the obstruction. So both the side obstruction can be there. Then recurrent rhinitis, recurrent cold is there due to associated sinusitis. Because of the DNS, the sinus is also involved in the infection. It can cause sinusitis. So recurrent cold will be there. And due to sinusitis now, there will be your headache would be there. Headache will be there, neuralgia will be there. So I told you, if you remember in sinusitis, supraorbital headache is in case of frontal sinusitis. Infraorbital pain is maxillary sinusitis. Retroorbital pain is ethmoidal sinusitis. एक बार ही वो अपग्रेड किया है इसको, हो जाएगा अपने आप. Now, clinical feature. What will be the finding? What will be the sign and symptom? Due to mucosa, scratching of the mucosa on DNS, there will be crusting, and due to removing of crusting, there can be bleeding, and blood vessels over here, they get ruptured and they can cause epistaxis. Then hyposmia. Hyposmia is sensation of smell will be less than normal. Okay, if it is totally lost, we call it anosmia. If it is partially lost, we call it hyposmia. Then external deformity. You can see the deform like this. Deform nose will be there. Then what will be the sequel? What will be the subsequent sequel will be there? Due to DNS, sinusitis, inflammation of sinuses would be there. And due to obstruction, mouth breathing will be there. Due to mouth breathing, there will be snoring. And due to that, chances of infection of pharynx can cause pharyngitis. Then atrophy of the mucosa of the nose, atrophy will be there, rhinitis. And as in the lateral wall of the nose, there is opening of Stackian tube. So it can cause otitis media also. So if infection goes through this lateral wall of the nose to the external ear and middle ear, especially the middle ear, it can cause otitis media. Now, how to do diagnosis? The DNS diagnosis is very easy. Most of the people, you can see the external deformity. Then by lifting your tip of the nose, and if you throw the light, and if you use the nasal speculum, thaddeum nasal speculum, steel-made nasal speculum, you can see the deviation easily. And you can even see the hypertrophy. And sometimes you need to see the posterior growth. For that, you need posterior rhinoscopy. Now, treatment for this is SMR, submucous resection. And another is the septoplasty. Septoplasty is there. What happens is submucous resection, local anesthesia is given, xylocaine, 1% or 2% with ephedrine and all. And after that, first mucosa is inside. After mucosa, perichondrium. Okay, if it is cartilaginous part, then perichondrium is inside. And if it's bony part, then periosteum is inside. And grown part, okay, deformed part is taken away. Okay, so that is SMR, and it improved nowadays improved surgery is septoplasty. Plasty word means reconstruction. Now, indication for septal surgery, if there is obstruction in the breathing, if it causes epistaxis, bleeding from the nose, recurrent sinusitis, continue headache, then it is advised. Then if rhinoplasty, some people want to change their shape of the nose, and if deformed septum is there, that time we can do. Then transseptal surgery of a hypophysectomy. If pituitary gland surgery is to be performed and DNS is there, so same time the surgeon can correct your septum also, and from pituitary gland tumor can be removed. Most of the pituitary gland tumor, you know, the pituitary lies in the base of the brain. Okay, there you have pituitary fossa. So to approach that tumor, neurosurgeon has to go through the nose. Okay, through nose, they goes to this your sala turcica of sphenoid bone, where you have sphenoidal sinus. Okay, then they break the floor there, and then tumor is taken out. That time it can be repaired. Septoplasty, I told you, better improved surgery is septoplasty, the reconstruction. See here, as I told you, incision can be given here through the mucosa, perichondrium and periosteum, and defected part is removed. This is elevated through this instrument, and then part is removed. This is how it is removed. From here it is incised, and then after incision it can be removed. Then SMR, some mucosal resection through this. Now complication of the septal surgery. Always with the surgery complications are there. Complication, first complication, here you have little area, more communication of the blood vessels are there. So chances of rupture of capillaries and blood vessel can lead to the hemorrhage. Then it can lead to the, if hemorrhage is there, obviously bleeding will be clotted over there. Then septal hematoma would be there. Then Scandi infection in that hematoma can cause septal abscess will be there. And if abscess is not treated properly, it can damage the bone. It can cause perforation on the bone. Septal perforation will be there. If perforation will be there, nose deformity will be there like this, saddle shape. Okay, saddle shape nose deformity will be there. Then columella, this lower part where I am touching, this is known as columella. Okay, that is made up by the skin. That is retracted back. Columella will be retracted back. Then flapping of the septum. Septum flaps would be there. Then deviation, first is recurrent deviation would be there. Then nasal syncytia will be there. Then CSF rhinorrhea, if damage is there to the roof of the nasal cavity where you have cribriform plate, from there CSF can be leaked out, infection can be there, and toxic shock can be there. So these are the complications of surgery. Then septal hematoma, the clotted blood will cause collection of blood under the perichondrium. Perichondrium is covering membrane of the cartilage, or periosteum covering membrane of the this bone can cause the hematoma, and it can cause infection. The etiology, nasal trauma, injury to the nose can be there, septal surgery can be there, or bleeding disorder. Then clinical feature. Clinical feature, bilateral nasal obstruction. If damage to there, then bilateral nasal obstruction will be there. Sense of pressure over here. Sense of pressure would be there. Bilateral smooth rounded, okay, smooth rounded septal swelling would be there. On palpation, mass is soft. Due to bleeding and all, it will be the soft and fluctuant.